Welcome back to continue the conversation. I'm your host, Tega Aurora. This is a very special episode. It's a rapid fire episode. It's something that's happening in real time. Let's start with the reality that doesn't get talked about enough or nearly enough. In one of the wealthiest countries in the world, people are dying from pregnancy-related complications, and the burden is not shared equally. In the United States, Black women are significantly more likely to experience maternal health complications and mortality. And while that statistic has been cited over and over again, the question is, what are we actually going to do about it? Today's episode is about solutions. I'm joined by Congresswoman Lauren Underwood, a registered nurse and one of the leading voices behind the Momnibus Act, a comprehensive set of bills aimed at addressing maternal health crisis in America. In this conversation, we're going to break down what the Momnibus actually is, why maternal health is both a policy issue and a justice issue, and how legislation can directly impact the outcome for families across the country. As we talk about how these conversations are showing up in culture, from social media to celebrity advocacy, and why awareness alone isn't enough without action. This episode is about care, policy, and what it looks like to fight for people's lives in the real, tangible way. Let's get into it. And here's my conversation with Representative Lauren Underwood. Hello, everyone. I have the pleasure of having Representative Lauren Underwood with me this morning. Good morning, Representative. How are you doing?
Morning. I'm so happy to be back with you.
I'm excited that you're here. We're going to get into it because a lot is happening right now, and we're going to talk about the Momnibus bill. And for me, it was really interesting to hear from you directly at the DNC. And now to see the progression of years, like, it's not getting better. Like, people are really trying to take away maternal care and they don't really care about it. So I want to start with, what is the biggest misconception people have about maternal health in America?
I think folks think everything is fine. There's a really kind of limited set of years that people are experiencing maternal health care firsthand, if they do at all, whether it's through themselves, a sibling, a good friend, or a partner, right? And so, for many Americans, they just remember the arrival of this beautiful, healthy baby and may not have had exposure to the details of America's maternal health care system.
Yeah.
And so that assumption that everything is fine has allowed for disparities to persist and the maternal death rates to get worse consistently over the last several years. And so here we are in 2026 with maternal death rates worse than when I got sworn in Congress. And since I got sworn in 2019, we've had three kind of major catastrophes, really. COVID, the Dobbs decision, and now these Trump Medicaid cuts that are going to devastate maternal health care and cause more moms to die. And I just think people's assumptions have kind of allowed this to continue on.
With that being said, for the people who are hearing this for the first time, what exactly is the Momnibus bill, the Momnibus Act in general, for people to better understand as we dive a little deeper into the conversation?
Sure. So the Momnibus is a piece of legislation. It is comprehensive, designed to address every clinical and non-clinical factor leading to America's maternal health crisis. So in the United States, 80% of maternal deaths are preventable, meaning that the researchers and scientists and providers know why moms are dying and know what kind of intervention is needed to save their lives. So we talked to many of them, and we put it all together into this bill. It's 14 bills in one.
Oh,
so
wow.
the Momnibus is the play on words. It takes the legislative word omnibus, so that just means big bill, but for moms. So we can say it together, Momnibus. And we're excited that it's going to be introduced this week into Congress, and it's just been updated to reflect this current moment.
Awesome. Well, we're going to talk more in like the pop culture realm, because what we're seeing is more conversations about pregnancy complications and maternal health in media and pop culture. Do you think these stories really bring attention to the issue, or they're kind of downplaying it?
I think they bring attention because when we hear about a Beyonce or a Serena Williams, when we hear about, the greatest track star of all time, Allison Felix, we are talking about women with incredible, resources like wealth, incredible access to great healthcare, particularly the athletes, the number of doctors and trainers that they're interacting with. And yet there's still racism You know what
Yep.
I mean? They're still not being heard necessarily when they enter into our healthcare systems, and they're experiencing these severe complications that could be deadly. And that is something that it is certainly relatable to the experience of many moms in this country, and it kind of it bursts the myth that it's just low-income moms
Yeah.
or just moms in rural areas or just just one type of low education. That's my favorite. Oh, it's just the ones that didn't graduate high school. Like, no. And so it really just emphasizes how much of a problem this is, that even the people that we assume or we believe should be kind of immune from this particular societal ailment are not.
And I want to talk about Black women maternal health care because, again, as a woman right now who want to have kids in her future, I'm scared. I'm really worried that we're not receiving the same health care and we're experiencing a lot of prejudices and racism. And I want to address that from your point of view. And why do you see that consistently happening? And what are you doing effectively with policy to help that not happen to Black women like me who in the future want to have kids and survive it, hopefully? Yeah.
So one of the things I think we've been successful as the Black Maternal Health Caucus is raising awareness of our nation's maternal health crisis, and particularly for Black women. I think everyone now knows in more detail than many of us would even necessarily want to know about the maternal health crisis looks like and how that could manifest in our lives. And so that awareness piece has been covered, so much so that you are expressing some anxiety or fear or uncertainty about what could happen if you were to try to have a baby. And, I really believe that the news of a new baby should be met with like joy and wonder and hope and excitement. And, that should not be a set of feelings that only certain moms in this country get to feel. And so now this burden and there's a physicality to this burden. Like this is a burden that can sit deep and it can impact, I don't know if you are familiar with the research around like how we carry stress at a cellular level, right? Like that's the kind of thing that can really, hurt, quite frankly. And so we don't want that awareness to cause more damage. That's not what I'm trying to do here. But what I am trying to do is say, listen, it's a problem. There's these solutions. And let's talk about the solutions. Let's commit to making those solutions available in every zip code for all moms so that we no longer have these types of disparities and high maternal death rates, right? So while I think it's great that and hopefully that knowledge helps empower you to make great decisions and to be a strong advocate for yourself and to pick the best providers and to go ahead and get a doula and do all the things. I don't want that knowledge to be another that you have to overcome to have a healthy pregnancy.
Thank you. I'll take that hope in the future.
Yeah.
And knowing that there are people out there, especially you, Representative, who are fighting for better healthcare for Black women in general, because I see what it's like. I've experienced mistreatment in the medical system when it comes to reproductive care, and I know how that has affected me and will affect my future. But hearing your words and your optimism means that there's hope out there. And with that, I want to ask you, when you think about families this legislation could impact, what stories come to mind around the Momnibus bill?
So, 14 bills, that's a lot of stories. That's a lot of families. And so the first bill in the package is social determinants for moms. And so that's trying to increase access to transportation and housing and, healthy environments. The things that could lead to people in the course of their day-to-day life just having a poor health status. And as a nurse, I can't tell you the number of stories of people who want to be able to have that follow-up appointment, but they can't get there. You know what I mean? Like the bus stops in the middle of the day, or, the train doesn't let you make the specific time that your doctor is available. And those seemingly small inconveniences really can have devastating impacts. And so, and obviously moms who are experiencing homelessness or just an insecurity and the stress that insecurity provides, right? That's where, to me, the solution is right there. And As nurses, we work with people one-on-one to get access to those community resources. For some facilities, they have social workers that do that same type of a thing. But this allows us to take a step back at a kind of national societal level and just say, like, let's just solve the problem. And I really get excited about that because we shouldn't have those types of barriers that are causing moms to die.
Yeah.
We have a bill in the package called the Kira Johnson Act. It's the only one that's named after a woman.
Yeah.
And Kira, I didn't know her personally. I know her husband, Charles, who after Kira passed, has become a tremendous maternal health champion and advocate. Her family has been so generous to lend her name to this package, right? And to this bill that would increase resources so that community-based organizations could get some help, some money to do their life-changing work. I mean, talk about legacy. In the midst of like deep pain, she had two beautiful boys who are now, growing up to be really active, exceptional young men, and they get to point to this bill and be like, this is also who my mom is. And that means a lot to me, and I try to honor her and them as we try to advance the Momnibus.
Thank you, Representative. Just a couple final questions to wrap it up for us. It's like, for people who want to support better maternal health outcomes, what are some of the ways they can get involved and better be informed, honestly?
Yes. So obviously you can follow us online at BMH Caucus. Okay. And then I think that's on Twitter and Instagram. And then
I'll link it below for everyone.
Thank you. And then it's really important that everybody call their senators and representative and ask them to co-sponsor the Momnibus. Okay. And so we will also make sure that you get the HR number, the S number, once we file the bill. And the call is like really easy. Listen, I know a lot of Gen Z folks don't like to make phone calls. I hear you on that kind of anxiety around calling somebody, a stranger on the phone, but this is going to be really easy. It'll be 2 minutes times 3 phone calls, 6 minutes of your time to save moms' lives. I think it's worth it. And you just call and say, who you are, what zip code you have, and then how important you think it is for that, your representative or your senator to co-sponsor this bill. If they're a Democrat, call them. If they're a Republican, call them. Doesn't matter. We need everybody's support. And your voices and your advocacy can help us get it done.
Awesome. What keeps you hopeful when you think about the future of maternal health in the United States?
I'm hopeful because there's been a lot of advancements, new technology, new resources. We've seen new partnerships, people who care about this issue and want to join us in this work of saving moms' lives. And so that's exciting. You know what I mean? It's not like even if the statistics are moving in the wrong direction, we are moving forward. And I believe that even in this moment with the Trump presidency, and even in this moment where, you got Robert Kennedy lying to the American people about the safety of vaccines or what's really going on with Tylenol or et cetera, his little beef tallow nonsense. We got all of that stuff. And still, they want a solution like the Momnibus too. And so, I just think it's up to us to do the work to get the bill in a place that it could pass and be signed into law. And that's what I'm committed to doing.
Awesome. Well, I'm going to leave the final word to you, Representative, what people need to know. What's the final thing you want to share with the audience so they know and take away from this episode?
Well, since y'all heard from me, we've been working. We got another $100 million in Momnibus priorities signed into law, meaning that money is coming into your neighborhoods. Do not be in despair. We are trying to solve this problem, and you may be surprised at what resources are available in your community. So you can visit our website. We have something called a Momnibus Money Tracker, where you can go and see who got what money to solve this problem in your community. And maybe that's an opportunity for you to tap in to be able to solve a problem. So I'm just going to offer that as we close and just say, thanks for having me. This has been a real treat.
Thank you so much, Representative. I appreciate it. And I'm really excited for people to take part and really take more hands-on action to their reproductive care, their maternal care, and fighting for what they truly deserve as Americans. So thank you so much.
Thank you.
That was my conversation with Congresswoman Lauren Underwood. What stands out most is that maternal health crisis isn't inevitable. It's preventable. And the Momnibus represents what it looks like when policy is designed with intent and data and equality at the center. But this conversation is also a reminder that awareness is only the first step. We've seen more people talk about maternal health across social media, in documentaries, and through celebrity stories. But real change happens when that attention translates into policy, funding, and accountability. So if this episode moved you, take it a step further. Learn about the policies being proposed, pay attention to what's happening in your state, support organizations doing the work on the ground, and more importantly, keep having these conversations because they are what matter. As always, thank you for continuing the conversation with me in this rapid episode. I will see you next time, friends. Bye.